Hi, this is Jonathan Rosenhead, Jerusalem psychotherapist. This week's Torah and Psychology post with Parshas Tazria-Metzora is titled, Is it a psychological or physical illness? These two parshas discuss the infliction, the illness of saras, where a person is inflicted with a physical sign on their body. And we know that this is as a result of speaking lashon hara, gossiping and slandering, that this sign appears on their body. And as a result, they need to go into quarantine. They need to stay there until they get better, until the physical sign goes away from their body, and then they can return to be with the rest of the camp, with the rest of Bnei Yisrael. So this sounds like a physical illness, a physical infliction. But we learned that a person only becomes a Metzora, is only given the title of being a Metzora, of someone with saras, when they go to the Kohen. And the Kohen assesses the sign on their body, and then makes the declaration that the person is a Metzora, and then they have to go into quarantine. So what we see is even if they have this physical sign on their body, until they go to the Kohen, and until the Kohen declares them to be a Metzora, they do not have saras. It doesn't matter if they have this physical sign on their body. It requires the Kohen to assess, and to the Kohen to decide. And therefore, we can say that what looks like and sounds like and is even treated like a physical illness, actually is a spiritual illness. It is assessed by a Kohen, and it is declared by the Kohen, and it is only, in a sense, only activated through the spiritual assessment and declaration of a Kohen. And therefore, we can say that it is a spiritual infliction, a spiritual illness that manifests through the body, but is not a physical illness. So when we see this, and we look at this idea of saras, and we apply it to psychology, it relates to this interplay between a physical illness or a psychological illness. When someone presents a physical problem to a therapist, when they come complaining of certain physical symptoms, it is important that the therapist, or the psychologist, or the mental health professional is able to discern and understand and appreciate what the actual problem is, and to understand, are the symptoms as a result of a physical illness, or are the symptoms a result of a psychological illness? What is the actual problem? What is the actual illness? So we can split it into two categories. There are psychological symptoms that are a result of a physical problem, and there are physical symptoms that are a result of psychological problems. So firstly, psychological symptoms as a result of physical problems, as a physical illness. You can say, when we look at the idea of anxiety and depression, these are very common psychological illnesses. But there are cases where a person who is complaining of anxiety, where the actual cause is of a physical nature. It could be, for example, heart disease or a heart attack, or low or high blood sugar levels, or over or underactive thyroid. And all these symptoms need to be taken into account, for example, and assessed, to understand that the anxiety is actually it can be a result of is a physical nature, a physical cause. Or depression, it could be a vitamin D deficiency, or chronic fatigue, or pain. Or again, someone person may maybe have an underactive thyroid, or irritable bowel syndrome. These are all symptoms which are physical nature, and they will therefore contribute towards the symptoms of depression. But the problem itself is not depression. It's not of a psychological nature. Or postpartum depression, with the hormonal changes in a woman's body after giving birth, contributes to a feelings of depression, where the depression is physiological, biological in nature, rather than necessarily being purely psychological. Or there's something which is known as PANDAS OCD. PANDAS is an acronym for Pediatric Autoimmune Neuropsychiatric Disorders as a result of strep. So what happens is, we have a child who starts to develop OCD, obsessive compulsive disorder symptoms, or tic, or we can say, or a tic disorder. But this sudden onset of these symptoms are actually as a result of strep. It's a result of the infection. It's not treated psychologically, but rather through antibiotics. It's physical. It's physical in nature, the OCD symptoms. But if we flip it, from the other side, there are physical symptoms which are a result of a psychological illness. So, for example, we know that the research has studied people that have chronic mental illness. They suffer from psychological stress on a long-term basis. As a chronic mental illness, it has a physical effect. It weakens the immune system, and it quite literally turns into a physical illness as well, that it can be dangerous to the person's health because they are suffering from long-term mental illness. Or the research now into PTSD often has taken the view that post-traumatic stress disorder is a trauma that is stored and is experienced within the body. So therefore the symptoms of hyperarousal, sweating, shortness of breath, difficulty sleeping, or if there's pain that they have in the body, these are all symptoms that are as a result of the trauma that they experienced. And therefore it is physical. There are physical symptoms that are experienced by the body as a result of the trauma that a person experienced. So we see here this interplay, this distinction that that within therapy needs to be made between the physical or psychological illness, and it is vital that before providing therapy, any physical symptoms or physical causes are ruled out. And therefore, a person should be sent to their doctor to do tests to work out primarily if the problem that they're experiencing is actually physical in nature, that the cause is physical and can be treated in a physical, biological way rather than in a psychological way. If that is not the case, then indeed therapy should continue, and therapy should work based on a psychological basis that understands the interplay between the mind, the emotions, and the body, but it's not focusing on the physical aspect in isolation, because they understand that the problem is psychological in nature. Have a great Shabbos and keep well.